Imagine a sudden, terrifying event that instantly robs someone of their ability to speak, move, or even recognize their loved ones. This isn't science fiction, it's the brutal reality of a stroke, a medical emergency that strikes every 40 seconds somewhere in the world, making it a leading cause of death and long-term disability globally. The impact is immediate and profound, affecting not just the individual but their entire family and support network. We've all heard the word stroke, but do we truly understand the intricate mechanisms behind this devastating condition? It's far more complex than a single event, encompassing different types with distinct origins, requiring vastly different approaches to diagnosis and treatment. Today, we're going to pull back the curtain on this neurological crisis, delving deep into its two main forms and why understanding them is literally a matter of life and death. At its core, a stroke is what happens when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and vital nutrients. Within minutes, brain cells begin to die. Think of your brain as the command center of your entire body, controlling everything from your thoughts and emotions to your movements and senses. It requires a constant, uninterrupted flow of oxygen-rich blood to function. When this supply is compromised, the consequences are immediate and catastrophic, leading to a rapid decline in brain function. The exact symptoms depend on which part of the brain is affected and how long the interruption lasts, but the underlying principle remains the same: time is brain, and every second counts. There are two primary categories of stroke, each with distinct causes and mechanisms: ischemic strokes and hemorrhagic strokes. While both types result in brain damage due to impaired blood flow, the way that blood flow is disrupted is fundamentally different. An ischemic stroke occurs when a blood clot blocks an artery supplying blood to the brain, much like a dam obstructing a river. A hemorrhagic stroke, on the other hand, is caused by a blood vessel rupturing and bleeding into the brain tissue, similar to a pipe bursting. Understanding these differences is not merely academic, it's crucial because the treatments for each type are often polar opposites. What might save a life in one scenario could be fatal in another. Let's begin our deep dive into ischemic strokes, which account for approximately 87% of all stroke cases, making them by far the most common type. This means that for nearly 9 out of 10 stroke patients, the problem stems from a blockage. To put this into perspective, imagine a vast highway system, where blood vessels are the roads and blood cells are the vehicles carrying essential supplies. In an ischemic stroke, a traffic jam or a major roadblock forms, preventing vital resources from reaching their destination, the brain cells. This deprivation, if prolonged, leads to irreversible damage and loss of function in the affected brain region. Ischemic strokes are broadly categorized into two main subtypes: thrombotic and embolic. A thrombotic stroke occurs when a blood clot, or thrombus, forms directly within an artery that supplies blood to the brain. This usually happens in arteries already narrowed by atherosclerosis, a condition where fatty deposits, called plaque, build up on the inner walls of the arteries. This plaque can rupture, leading to clot formation that then blocks the vessel. It's a slow, insidious process often developing over years, making it a local blockage within the brain's own vascular system. Patients often have a history of risk factors like high blood pressure or diabetes. An embolic stroke, conversely, occurs when a blood clot or other debris forms elsewhere in the body, often in the heart or a large artery in the neck, and then travels through the bloodstream until it reaches an artery in the brain too narrow to pass through. This traveling clot is called an embolus. One of the most common causes of embolic strokes is atrial fibrillation, an irregular heart rhythm where the atria, upper chambers of the heart, beat chaotically, allowing blood to pool and clots to form. When these clots break off, they become dangerous projectiles heading straight for the brain, causing a sudden and often more widespread blockage than a thrombotic stroke. The primary cause of both thrombotic and embolic ischemic strokes is often atherosclerosis, a hardening and narrowing of arteries due to plaque buildup. This insidious process is fueled by a range of modifiable risk factors. High blood pressure, high cholesterol, diabetes, and smoking are among the biggest culprits. Imagine these factors as constant aggressors damaging the delicate lining of your blood vessels, creating perfect breeding grounds for plaque. Over time, these plaques can grow, restrict blood flow, or become unstable and rupture, triggering clot formation. The cumulative effect of these lifestyle choices significantly increases the likelihood of an ischemic event. Other conditions that increase the risk of ischemic stroke include atrial fibrillation, as mentioned, which can lead to blood clots forming in the heart. Obesity and physical inactivity also contribute to a higher risk by exacerbating other conditions like hypertension and diabetes. Certain genetic predispositions, specific heart conditions like patent foramen ovale, PFO, or even less common blood clotting disorders can also play a role. It's a complex interplay of genetic, lifestyle, and medical factors that ultimately determines an individual's susceptibility to this type of stroke. Therefore, a comprehensive understanding of a patient's medical history is paramount. Now, let's pivot to the less common but often more deadly type, hemorrhagic strokes. These account for about 13% of all strokes but are responsible for a disproportionately higher number of stroke-related deaths. While ischemic strokes are about blockages, hemorrhagic strokes are about bleeding. Instead of a lack of blood, there's an excess of it, but in the wrong place, inside the brain tissue itself, or in the spaces surrounding it. This causes direct damage to brain cells, plus increased pressure within the skull, which can severely compress and injure brain tissue, leading to widespread neurological damage. It's akin to a pressure cooker within the confines of the skull. Hemorrhagic strokes are primarily divided into two main types, intracerebral hemorrhage, ICH, and subarachnoid hemorrhage, SAH. An intracerebral hemorrhage occurs when a blood vessel within the brain ruptures, spilling blood directly into the brain tissue. This bleeding creates a hematoma, a pool of blood that puts pressure on nearby brain cells, damaging them directly and disrupting their function. This type is often linked to uncontrolled high blood pressure, which weakens blood vessel walls over time, making them prone to bursting under pressure. It's like a worn-out hose pipe finally giving way. A subarachnoid hemorrhage, SAH, on the other hand, occurs when bleeding happens in the subarachnoid space, the area between the brain and the thin tissues that cover it. This space is normally filled with cerebrospinal fluid. The most common cause of SAH is a ruptured aneurysm, a weak, balloon-like bulge in the wall of a blood vessel. When an aneurysm bursts, blood rapidly fills this protective space, leading to a sudden, severe headache often described as the worst headache of my life. This sudden influx of blood causes immense pressure and chemical irritation to the brain, leading to rapid neurological decline and often severe complications like vasospasm. The primary risk factor for hemorrhagic stroke, especially intracerebral hemorrhage, is uncontrolled chronic high blood pressure. Over years, this relentless pressure weakens the walls of small arteries deep within the brain, making them brittle and susceptible to rupture. Other risk factors include cerebral aneurysms and arteriovenous malformations, AVMs, which are abnormal tangles of blood vessels that are prone to rupture. Use of blood thinners, anticoagulants, illicit drug use, especially cocaine and methamphetamine, and head trauma can also significantly increase the risk. These factors, individually or in combination, create a precarious environment where a sudden spike in pressure can lead to a catastrophic bleed. While risk factors for both types of stroke can overlap, there are crucial distinctions. For ischemic strokes, factors like atherosclerosis, high cholesterol, and atrial fibrillation are paramount. For hemorrhagic strokes, uncontrolled hypertension, aneurysms, and AVMs take center stage. Imagine two different battlefields, one where the enemy tries to blockade your supply lines, and another where they try to blow up your critical infrastructure from within. The strategies to prevent and fight these battles are naturally different. Recognizing these distinct risk factor profiles is essential for targeted prevention strategies and for medical professionals to quickly narrow down the likely type of stroke when a patient presents with symptoms. Recognizing the symptoms of a stroke, regardless of type, is paramount, as early intervention significantly improves outcomes. The mnemonic FAST is widely used to help people remember the key signs: face drooping, arm weakness, speech difficulty, time to call emergency services. This acronym emphasizes the urgency, highlighting that every minute delay in treatment can mean millions of brain cells lost. But beyond these core symptoms, strokes can manifest in a myriad of ways depending on the affected brain region, including sudden severe headache, confusion, vision problems, and loss of balance or coordination. Any sudden onset of these neurological deficits should trigger immediate concern. While the FAST acronym is excellent for general awareness, specific symptoms can sometimes hint at the type of stroke. For example, a sudden, explosive headache, often described as the worst headache of my life, is a hallmark symptom of a subarachnoid hemorrhage. While headaches can occur with ischemic strokes, they are less common and usually not as severe or sudden. Nausea and vomiting are also more frequently associated with hemorrhagic strokes due to the increased intracranial pressure. However, these are not definitive diagnostic tools. Any stroke symptom warrants immediate medical evaluation, as overlapping symptoms can make self-diagnosis unreliable and dangerous. Upon arrival at the emergency room, rapid and accurate diagnosis is critical. The first and most crucial diagnostic tool is usually a brain imaging scan, typically a CT, computed tomography, scan. A CT scan can quickly differentiate between an ischemic and a hemorrhagic stroke. It works by using X-rays to create detailed cross-sectional images of the brain. Blood from a hemorrhage appears bright white on a CT scan, making it immediately visible. An ischemic stroke, however, may not show up on a CT scan in the very early hours, as the affected brain tissue changes are not yet dense enough to register. This initial scan is paramount, as it dictates the immediate course of treatment. If the CT scan doesn't clearly show an ischemic stroke, but suspicion remains high, an MRI, magnetic resonance imaging, scan may be performed. MRI provides more detailed images of brain tissue and can detect ischemic changes earlier than CT. Additionally, vascular imaging techniques like CT angiography, CTA, or Mr. angiography, MRA, are often used to visualize the blood vessels in the brain and neck. These scans can help identify blockages, narrowed arteries, aneurysms, or AVMs, providing crucial information about the cause and location of the stroke. These advanced imaging modalities are vital for planning targeted interventions, especially for patients who are candidates for clot retrieval. Beyond imaging, other diagnostic tests are essential. Blood tests are conducted to check blood sugar levels, clotting factors, and electrolyte balance, all of which can mimic stroke symptoms or influence treatment decisions. An electrocardiogram, ECG or EKG, is used to check for heart rhythm abnormalities like atrial fibrillation, a common source of emboli. Carotid ultrasound may be performed to assess for narrowing of the carotid arteries in the neck, another frequent cause of ischemic stroke. These comprehensive evaluations help paint a complete picture of the patient's condition, guiding medical teams towards the most effective and safest treatment plan. Now, let's talk about treatment, starting with ischemic strokes. The cornerstone of acute ischemic stroke treatment is reperfusion therapy, restoring blood flow to the brain as quickly as possible. The most common and effective medication for this is tissue plasminogen activator, or TPA, often called a clot-busting drug. TPA works by dissolving the blood clot that is blocking the artery, allowing blood to flow freely again. However, TPA is extremely time-sensitive. It must be administered intravenously within a narrow window, typically within 4.5 hours of symptom onset, to be most effective and safe. Beyond this window, the risks often outweigh the benefits, particularly the risk of converting an ischemic stroke into a hemorrhagic one. For larger clots in major arteries, particularly those in the anterior circulation, a procedure called mechanical thrombectomy has revolutionized ischemic stroke treatment. This involves a neurosurgeon inserting a thin tube, catheter, into an artery, usually in the groin, and guiding it up to the brain to physically remove the clot. Mechanical thrombectomy can be performed up to 6, and in some select cases even up to 24 hours, after symptom onset, significantly extending the treatment window for eligible patients. This procedure, when successful, can dramatically improve outcomes for patients who might otherwise face severe disability, literally pulling a patient back from the brink. Beyond acute interventions, long-term management for ischemic stroke focuses on preventing recurrence. This involves managing underlying risk factors like high blood pressure, diabetes, and high cholesterol through medication and lifestyle changes. Antiplatelet medications, such as aspirin or clopidogrel, are commonly prescribed to prevent new clots from forming. For patients with atrial fibrillation, anticoagulants like warfarin or newer direct oral anticoagulants, DOACs, are essential to prevent blood clots from forming in the heart. Lifestyle modifications, including a healthy diet, regular exercise, and smoking cessation, are also crucial components of a comprehensive prevention strategy. Now, let's discuss the treatment for hemorrhagic strokes. Unlike ischemic strokes, where the goal is to break up a clot, the primary goal for hemorrhagic strokes is to stop the bleeding, reduce intracranial pressure, and manage complications. Administering TPA, a clot buster, to someone with a hemorrhagic stroke would be catastrophic, as it would worsen the bleeding. Therefore, identifying the type of stroke quickly is paramount. Initial medical management often involves medications to lower blood pressure, reduce brain swelling, and control seizures, which are common after brain bleeds. The focus is on stabilizing the patient and preventing further damage. For subarachnoid hemorrhages caused by a ruptured aneurysm, surgical intervention is often required to prevent rebleeding, which is highly dangerous. This can involve clipping or coiling the aneurysm. Surgical clipping involves opening the skull, craniotomy, and placing a tiny metal clip at the base of the aneurysm to seal it off from the blood flow. Endovascular coiling, a less invasive procedure, involves inserting a catheter into an artery and guiding it to the aneurysm, where tiny platinum coils are deployed to fill the aneurysm and block blood flow, causing it to clot. The choice between clipping and coiling depends on the aneurysm's size, location, and the patient's overall health. For intracerebral hemorrhages, especially larger ones, surgical removal of the hematoma may be considered if it's causing significant pressure on the brain or if it's in an accessible location. The decision to operate is complex and depends on factors like the size and location of the bleed, the patient's neurological status, and their overall medical condition. Sometimes, a procedure to drain excess cerebrospinal fluid, ventriculostomy, might be necessary to relieve pressure within the skull, regardless of whether the hematoma itself is removed. The delicate balance involves weighing the risks of surgery against the potential benefits of reducing brain compression. After the acute phase of either type of stroke, rehabilitation is a critical and often long journey. Stroke rehabilitation helps patients regain lost functions and adapt to new challenges, aiming to improve their quality of life. This multidisciplinary process involves physical therapy to restore movement and strength, occupational therapy to relearn daily living activities, and speech therapy to address communication and swallowing difficulties. Neuropsychologists may also be involved to help with cognitive and emotional issues. The intensity and duration of rehabilitation vary greatly depending on the stroke's severity and the individual's progress, often continuing for months or even years. The recovery process is highly individual. Some individuals experience remarkable recoveries, regaining nearly all lost functions, especially with early and intensive rehabilitation. Others may face permanent disabilities, requiring ongoing support and adaptations. Factors influencing recovery include the severity and location of the stroke, the patient's age and overall health, and their motivation and access to quality rehabilitation services. It's a testament to the brain's plasticity, its ability to rewire itself and form new connections, but it's a challenging uphill battle that requires immense patience, perseverance, and a dedicated support system. Every patient's journey is unique. Preventing stroke is always better than treating it, and many risk factors are modifiable. Controlling high blood pressure is perhaps the single most important step. This means regular monitoring, adhering to prescribed medications, and adopting a heart-healthy lifestyle. Managing diabetes and high cholesterol, quitting smoking, reducing alcohol consumption, maintaining a healthy weight, and engaging in regular physical activity are all powerful ways to lower your stroke risk. These lifestyle changes aren't just about preventing stroke, they contribute to overall well-being and a longer, healthier life. It's about taking proactive steps to safeguard your most vital organ. Regular medical checkups are essential for screening and managing underlying conditions that could increase stroke risk. Your doctor can assess your individual risk profile, recommend appropriate screenings, and guide you on personalized prevention strategies. For example, screening for atrial fibrillation, especially in older adults, can lead to early diagnosis and initiation of anticoagulants, significantly reducing embolic stroke risk. Similarly, managing carotid artery disease through medication or sometimes surgery, carotid endarterectomy, can prevent thrombotic strokes. Proactive engagement with your healthcare provider is a powerful tool in your stroke prevention arsenal. Beyond individual actions, public awareness campaigns play a vital role in improving stroke outcomes. Initiatives like FAST campaigns empower the public to recognize symptoms and act quickly. Rapid recognition and calling emergency services immediately can drastically cut down the time to treatment, which is crucial for brain preservation. Community education about risk factors and healthy lifestyles also contributes to a healthier population overall. The more people understand about stroke, the better equipped we are as a society to prevent it and respond effectively when it strikes. It's a collective responsibility to be vigilant. Research continues to advance our understanding of stroke and develop new treatments. Innovations in imaging allow for more precise diagnosis and selection of patients for thrombectomy in extended windows. New medications are being developed to protect brain cells during and after a stroke, neuroprotection. Advances in rehabilitation therapies, including robotics and virtual reality, offer new hope for improved recovery. The field of stroke medicine is constantly evolving, pushing the boundaries of what's possible and offering renewed optimism for those affected by this devastating condition. The future holds promise for even better outcomes. Understanding the fundamental differences between ischemic and hemorrhagic strokes is not just medical knowledge, it's empowering. It highlights why a rapid and accurate diagnosis is critical, as treatments are vastly different and often contradictory. It underscores the importance of risk factor management and the potential for prevention. And it emphasizes the urgent need for quick action when stroke symptoms appear. This knowledge can literally save lives and improve the quality of life for countless individuals globally. Be informed, be aware, and act fast. Consider the impact of a stroke on an individual's daily life. Simple tasks like eating, dressing, or speaking can become immense challenges. The emotional toll is equally significant, with many stroke survivors experiencing depression, anxiety, and frustration as they grapple with their altered abilities. Family members often become caregivers, facing their own set of physical and emotional burdens. The ripple effect extends to employment, social life, and overall independence. It's a life-altering event that demands not only medical intervention but also profound empathy and a comprehensive support system for long-term recovery and adaptation. The economic burden of stroke is staggering. Globally, it costs billions of dollars annually in healthcare expenses, lost productivity, and long-term care. This financial strain impacts healthcare systems, governments, and individual families. Investing in stroke prevention, early detection, and effective rehabilitation not only saves lives and reduces disability but also yields significant economic benefits by reducing the need for costly long-term care and enabling individuals to return to productive lives. It's an investment in public health that pays dividends across society. Finally, let's touch upon transient ischemic attacks, TIAs, often called mini-strokes. A TIA is a temporary period of symptoms similar to those of a stroke, but they resolve within minutes or hours, typically without causing permanent brain damage. While not as severe as a full stroke, a TIA is a critical warning sign that should never be ignored. It indicates a temporary blockage in a blood vessel supplying the brain, and it's a strong predictor of a future full-blown ischemic stroke. Seeking immediate medical attention for a TIA is crucial to identify the underlying cause and implement preventative measures before a more devastating event occurs. Think of it as a crucial alarm bell that demands immediate attention. In summary, ischemic strokes are caused by blockages, most often blood clots, depriving brain tissue of blood. Hemorrhagic strokes are caused by bleeding, usually from ruptured blood vessels, damaging brain tissue and increasing pressure. The treatments are fundamentally different: clot busters and mechanical removal for ischemic, and stopping bleeding/reducing pressure for hemorrhagic. While their mechanisms differ, both are medical emergencies requiring immediate recognition and rapid treatment. Remember the FAST acronym and always call emergency services at the first sign of a stroke. Your swift action can truly be the difference between life and death, or severe disability and meaningful recovery. We hope this detailed explanation has shed light on the complexities of stroke, demystifying the differences between ischemic and hemorrhagic types. Understanding these distinctions is not just for medical professionals, it's vital knowledge for everyone. By being informed, recognizing the signs, and acting quickly, we can collectively improve outcomes for stroke patients and work towards a future where fewer lives are devastated by this condition. Thank you for joining us on this important journey of understanding. Stay curious, stay informed, and always prioritize your brain health. Your brain is your most valuable asset, protect it.